Hi everyone, I'm just going to make a short video on the brachial plexus. Hopefully it'll help simplify it for you if you haven't learned it yet already, and maybe be a little bit more passive way to study over break when you're trying to relax. So I have this very rough outline. Hopefully you can see it on my screen here. And we're just going to start at the most proximal portion, which is the roots. So I'm going to write those labels in here. And then just like a tree, you go from roots to trunks. And I like to think of hanging a rope swing. So you hang the cords are next, on branches. So we'll go back to the nerve roots, and you should know those by now being C5 all the way down to T1. So I'll fill in all the numbers here, C5, C6, C7, C8, and T1. And if you haven't heard the brachial plexus story yet, we'll make sure to go over that at the end too. One thing I'd like to say about this, because it can seem kind of complex and overwhelming when you see all of it at once, learn it in layers, do the most big picture. So just like I'm doing now, start with roots and go to branches. Don't worry about all the connectors or all the extra branches coming off. Just go from roots all the way to the terminal branches. So that's what we're going to do first, and then I'll pause it and we can add some of the branches coming off of the cords, etc., as we go. So we're going to go from cords just to trunks. So we have a superior, a middle, and an inferior trunk. And then cords, which you're probably pretty familiar with because you dissected those in lab, of the lateral cord, the medial cord, and then the posterior cord, and those are all in relationship to the axillary artery. So let's continue then to the branches, and we have, like you've probably seen also in lab, the big M structure. Oops. Let's see, it should connect here. And a line down the middle of the M, and then the posterior cord will have two terminal branches as well, so I'll throw those in there. So the first one on the top, which would be the most lateral here, should be our musculocutaneous nerve. Going down to the middle of the M, we have the median nerve. And as you can see, that has contributions from both the lateral and the medial cord. So this would be the lateral root to the median nerve, and this would be called the median, or medial root to the median nerve. And so then the final nerve of the M is the ulnar. And that leaves the two branches coming off of the posterior cord, which are the radial and axillary nerves. And one thing that would be good to do too, if you're watching this video, is to go through and start thinking about what is being innervated by these nerves that we're talking about, or maybe what spaces they run through. So for example, what space does the axillary nerve run through? And then what arteries corresponding travels with that nerve as well. So that is the big picture here. I like to point out, I'll do it in orange. I'll put these lines in for completeness sake, but it's not super important to understand all these connections here, because if you know the nerve roots, then you don't really have to know all these little lines here. And it can get a little bit confusing when you see all these crisscrosses. So don't worry about that too much. Again, start big picture and learn it in layers. So I'll go over the nerve roots really quickly. I'm going to temporarily stop sharing my screen. And if you haven't had the brachial plexus story yet, you're going to learn it now. So you have to use your hand, and we're going to go through the nerve roots again. So just like C5 to T1, you're going to have C5, C6, C7, C8, and T1. So you have these 5 nerve roots. And I'll tell the story and then I'll explain it. So the story goes that 3 musketeers assassinated, this little handgun, 5 mice, 5 rats, and 2 unicorns. But you have to have unicorns like this. So those are the ears of the unicorn. Your thumb can be the little horn. It's a funny looking unicorn, but you have to do it that way. The reason being, the ulnar nerve roots are the bottom 2 nerve roots of the brachial plexus. So let's go through it again and I'll explain it this time. So 3 musketeers. Musketeer sounds like musculocutaneous. So that's the musculocutaneous nerve. And then nerve roots are C5, C6, and C7. Next is assassinated. So A for axillary nerve. The nerve roots are C5 and C6. 5 mice, median nerve, C5 through T1, so all 5. 5 rats, R for radial, that's also C5 through T1. And 2 unicorns, ulnar nerve is just C8 and T1. Ulnar nerve roots are C8 and T1. So you have the median nerve, which is all 5. axillary nerve, C5 and C6, radial, all 5, and musculocutaneous, C5 through C7. So that is what I like to say is the first chunk of the brachial plexus. So start with that picture, learn that. I'm going to pause the video and come back and we'll add some branches. Okay, so I think the next best part to go over is the branches off of the chords. So I'm just going to move our labels down a little bit here. And we'll start talking about some branches off of the medial chord first. So medial chord has 3 main branches we'll talk about. One that corresponds to the same as the lateral chord. So we'll do those ones first. I guess we'll start with medial and lateral chord, but let's actually jump up to lateral. So lateral has the lateral pectoral nerve, which means, as you could probably guess, the medial chord has the medial pectoral nerve. And then the other 2 branches off of the medial chord are cutaneous branches. So you're going to have the medial brachial cutaneous and the medial antebrachial cutaneous nerve. All right, so medial brachial cutaneous and medial antebrachial cutaneous nerve. So you might hear medial cutaneous nerve of the forearm. That would be synonymous with medial antebrachial cutaneous nerve. So the reason, you probably know, but just as a reminder, the reason why there isn't a lateral antebrachial cutaneous nerve coming off of the lateral cord is because lateral antebrachial cutaneous is the terminal end of musculocutaneous nerve, because it gives motor innervation, the muscular innervation in the arm, and then cutaneous innervation to the forearm. So just like that, you already have the branches off of the lateral and medial cord done. Posterior cord is going to have 3 branches coming off too. One's an upper, one's a middle, and one's a lower. But the middle one has another name too. So these are all subscapular nerves. So upper, middle, and lower subscapular. But there's another name for the middle subscapular nerve. And if I told you that it's the innervation to the latissimus dorsi, then you will know that that is also called thoracodorsal nerve. So those are the main branches off of the cords, the nerves that you'd have to know coming off of those. Again, that's layer 2. So I say pause it there, learn those, and then we'll go through and do one more section. I'm going to pause the video here too, just to add a couple more branches that are coming off more proximally. But again, if you learn it in these pieces, then it's very manageable. All right, last section here, we're just going to add a couple more nerves that are coming off more proximally. So we talked about the subscapular nerves, but you know that there's also a suprascapular nerve. So luckily, even though it's not the exact same name, it sounds similar to superior cord. So our suprascapular nerve is going to come off of the superior cord. And there's another one that also has an S word, which is helpful. I guess, again, just lining up the S's, we have a little alliteration here. Nerve to subclavius also comes off here. All right, so those are the 2 from, I think, any of the trunks that you would have to know, at least to my knowledge. So I'll talk about 2 more nerves. One is just getting contributions from C5, and you've definitely heard about this nerve before. So I will draw this one in orange. So coming off of C5, we have the dorsal scapular nerve. And then one more nerve that we'll want to talk about, coming again right from nerve roots, is getting contributions from C5, C6, and C7. So it's often drawn like this, and hopefully this will be clear to you. I'll draw it down here. Maybe I'll use a different color. Let's use yellow. So I'll have the yellow coming down here. It's giving some contributions from C5, C6, and C7. So this one also has a little jingle. So this is the long thoracic nerve. And you've learned from Dr. Lobo's lecture that the long thoracic nerve innervates serratus anterior. And when that is cut out for whatever reason, might be leading to loss of innervation of that, you get a winged scapula. So if you have your patient put their hands against the wall in front of them, their scapula will stick out and it's called a winged scapula. So the little jingle for long thoracic nerve is C5, C6, C7 wings to heaven, because if you knock out long thoracic, you get a winged scapula. So C5 through C7, C5, 6, 7, wings to heaven, winged scapula if you knock out long thoracic. So the nerve roots for long thoracic are C5 through C7. So that is the brachial plexus, hopefully in a pretty straightforward way for you. You can break it up into pieces, and hopefully then you won't stress about learning it if you haven't gotten it down already.